Hello all, and welcome to our webinar this morning. I am Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges. We're going to let folks start coming in here to the webinar today. And with us, I'm very excited to have Dr. Korn. Dr. Korn is going to be leading us through how naturopathic medicine addresses ADHD and some of the surrounding issues, understanding some of the causes, understanding the condition, and understanding what naturopathic medicine has to offer. So I'm really excited to have you all with us today. And with that, Dr. Korn, if you can just forward to the next slide, please. So point number one is all done. I like checking off boxes. That box is checked. So a couple other housekeeping things. You are all going to be in listen only mode. If you do have questions, please use the Q&A function here to ask questions. We can track that a little bit more easily than if you're in the chat. So please use the Q&A for any questions that you may have. The forum is going to be recorded. So if you do miss a piece of this, you can go back and get the recording. If you have any issues or questions during the course of today, you can also email us at info@aanmc.org. And the other picture of me is Emily, and she'll be also in the background to answer questions that you may have as well as we go through today. So with that, I'm going to turn it over to Dr. Korn. Very excited to have you with us. This is a topic we hear a lot about, and I don't think you can open up any social media today without seeing some sort of scroll on ADHD. So anyway, really excited to have you with us and to introduce this topic to our audience. Thank you.
Thank you very much. I am really excited to be here. I think that ADHD is definitely something we hear about more and more. I'm going to talk a little bit about the TikTok effect, but people are talking about ADHD. We also know that over the past year or so, there have been some pretty significant shortages in medications for ADHD, Adderall first, but now also methylphenidate or Ritalin. So it's definitely a conversation that is happening. I'm really excited to be here and talk about all the ways naturopathic doctors can support folks with ADHD. I wanted to tell you a little bit about myself to get started. So I completed my undergrad education at UNC Chapel Hill, go Heels. I had my BA in International Studies, not super related to naturopathic medicine. So I did take about a year of prerequisites at Oregon State University before I went to National University of Natural Medicine for both my Master of Science in Integrative Medicine Research and my doctorate in naturopathic medicine. I think that having these two degrees for me really made sense at the time when I was studying. I liked being able to do them concurrently. I also appreciate the knowledge that I gained in both degree programs from NUNM because I think that the two degrees and the programs really support each other, and it supports my practice and how I like to work with patients. So I'm really big on evidence-informed practice, and naturopathic medicine is an evidence-informed form of medicine. We have a really pretty significant evidence base for what we are offering to patients, and we know how to use the research and the literature, and I think that's really important to have. I will also say that not everything I do is completely based on the available scientific research, especially when we talk about herbs. I use a lot of historical evidence and how traditional cultures used herbs to inform my practice when I'm using botanical medicine. And I think that kind of evidence is also important. That's valid as well. But I like to use all those pieces together when I'm working with patients. After I graduated, I completed 3 years of residency at NUNM Health Centers, which is a patient-centered primary care home in Oregon. So I worked with a lot of folks with Medicaid or folks who were underinsured or uninsured. And that made me have to get really creative about how I am working with patients and how I'm bringing naturopathic medicine to all types of people. I think that naturopathic medicine and natural medicine kind of gets lumped into this wellness culture where we're, only treating people who have access and have money to be able to afford expensive supplements or diets or those things. And that's just not the case. You can be really creative and bring natural medicine, natural options to people of all types, which I think is it's amazing. It's wonderful. Right now, I work as a primary care doctor in the state of Vermont. So I work with about 50% rural Medicaid patients and 50% patients who are either cash pay or have private insurance. I also have a telemedicine practice where I'm a men's health specialist. I have a colleague who does women's health, so I have some specialization in that. But a lot of my practice as a primary care provider, I work with folks with mental health issues like ADHD, anxiety, depression, those kinds of things. So today I want to talk to you about ADHD in adults specifically. I don't work with kids with ADHD as far as the diagnostic process, because I think that's a much more involved process, and you're really, there needs to be a lot more discussion between parents and teachers and caregivers and providers. So I tend to practice just with adults with ADHD, especially when I'm doing the diagnosis myself. We're going to talk a little bit about prevalence, symptoms, and treatment options for adults with ADHD. So we're going to talk about the full spectrum of naturopathic treatment options, dietary, nutritional supplements, botanical medicine, and medications, because I use it all in my practice. I have a quick case study at the end of the presentation where we'll go through how I worked through that with a patient, kind of looking at all of those different pieces with her. So with ADHD in adults, it can either be a persistent issue from childhood, or it can develop in adulthood. There are, different types, but oftentimes we see folks with childhood ADHD that does continue on into adulthood. We see that ADHD in both children and adults is more commonly diagnosed in men or boys than women or girls. And there's a lot of theories as to why that is. One is because with women, the symptoms of inattention may be more prevalent than the symptoms of hyperactivity. And so when you think about ADHD, oftentimes what comes to mind is a hyperactive little boy running around, can't sit still, right? Young girls don't always present that way, and so they don't get the diagnosis and they don't get the support. We also see that many adults in general, maybe they don't have persistent ADHD, it's diagnosed or developed in adulthood. Maybe they did have symptoms in childhood, but they just weren't diagnosed. Those symptoms were not recognized, and so they didn't get the support they need. That's challenging for folks to come to that realization that they may have had a pervasive, persistent issue with how they are processing information and how they are able to interact in the world, and not getting the support they needed and having to come up with a lot of compensatory strategies for that. So that's a piece that I talk to my patients about, is kind of that. It's almost a grieving process, right? Where you're kind of coming to this realization, but it's good to be able to get the support at some point. We do see higher rates of anxiety disorders, mood disorders like depression and bipolar disorder, and substance use disorders among adults with ADHD versus adults who do not have ADHD. So in this study from Kessler in 2006, which I realize is a little dated, but good information, we find that in the population of adults with ADHD, 47% also present with an anxiety disorder, whereas only about 18% of adults without ADHD in this study had an anxiety disorder. With mood disorders, we see about 38% with ADHD versus 11% without. And substance use among adults with ADHD in this particular population was around 17%, compared to about 5% in the adults without ADHD. So some really significant differences in these mental health comorbidities. And I think that when we are working with adults with ADHD, and I'm going to touch on this in the diagnostic piece, it's important to address all of those pieces and get down to what is actually causing the issues. Symptoms in adults, there are kind of 5 main ones that we focus on. So again, when you think of ADHD, when someone kind of in the general public thinks about what is ADHD, we think about inattention and hyperactivity. Inattention meaning that you're having trouble focusing, you're having trouble giving your attention to the thing that you want to give it to. Hyperactivity, running around, unable to sit still, being fidgety. There's also an aspect of impulsivity. We see this in adults. Think about the substance use disorder piece, right? There's some impulsivity, some issues with controlling impulses and controlling actions that often present in folks with ADHD. So that is another piece that plays into the adult experience with ADHD, not only in substance use, but also compulsive gambling, online shopping, risky sexual encounters. That can definitely come up in this population as well. I think that the two pieces that I see in my practice as being most impactful for adults with ADHD are issues with executive dysfunction and emotional dysregulation. So executive dysfunction is defined as self-directed actions needed to choose goals and to create, enact, and sustain actions toward those goals. And I think that for folks without ADHD, this is something we really take for granted. If you do not have HD and you come home and you see, okay, dog has to go out, I need to cook dinner, and I need to unload the dishwasher because I don't have any clean dishes, it may be easier for you to put those things in a linear order to make them happen. Whereas someone with ADHD who is struggling with executive dysfunction may not be able to easily arrange those priorities in a linear timeline to make them happen, which can kind of cause spiraling and can cause more executive dysfunction and inattention, and just kind of it's a cycle that perpetuates itself. So that is a problem that I see really frequently in adults, that executive dysfunction piece. It's very bothersome. The emotional dysregulation piece is something that also doesn't get brought up very frequently when we talk about ADHD. So emotional dysregulation can look like emotional lability, or labile emotion is emotions that change from high to low. They change really quickly and easily. So mood swings, irritability, angry outbursts, and low frustration tolerance. Low frustration tolerance is, let's say, it's kind of like the bucket analogy. Your bucket gets full and then one drop makes it overflow. With folks with ADHD, their buckets may be smaller. And so that one drop may come at times when folks without ADHD really don't understand why that person is getting so upset, why they're so frustrated, because it seems like something that should not make them upset. This doesn't have anything to do with them not being able to control their emotions. It's a neurotransmitter imbalance, so they're really not able to control that frustration piece and that angry outburst. Even though they might want to, they're not acting in a way that is, they're not trying to have that reaction. It just kind of happens. That can be really problematic for adults, especially when we think about maintaining relationships as an adult. Emotional dysregulation and executive dysfunction, especially in intimate partner relationships, can be really, really challenging for folks with ADHD, especially if they're not treating it at all, or if they haven't been adequately diagnosed. Think about how challenging it would be as a partner to work with a person who has issues with managing their day-to-day time, managing their day-to-day life, and also has these emotional dysregulation pieces. It can be challenging. And so if folks are not getting the support they need, that can lead to issues throughout every part of their life. When we think about prevalence in adults with ADHD, we see that persistent ADHD from childhood is about 3% of adults, and symptomatic adult ADHD, regardless of childhood onset or not, is close to 7%. Again, not all adults are going to have been diagnosed in childhood, because maybe they didn't have symptoms that were really crying out that this is ADHD, and so they got missed, they got ignored. So maybe that persistent adult ADHD from childhood onset probably should be a higher number than it is, versus, regardless of childhood onset, the symptomatic adult issue. Like I mentioned earlier, there is the TikTok effect. Social media in general is making people talk about mental health and making people talk about their mental health symptoms in a way that I think is both positive and negative. I think from the positive side, it's really good that people are talking about these symptoms and are talking about what they're feeling and normalizing and validating that experience for other people's. On the kind of con side, I think that can really pathologize a lot of normal or very common behaviors that are not necessarily ADHD. They're just, everybody loses attention and loses focus sometimes. So I think it's kind of a double-edged sword with that. But I will say that lots of folks have come into my office in the past couple years because they were watching a lot of TikToks during the pandemic, and they're recognizing some of these symptoms in themselves that they're seeing in folks talking about ADHD. So either way, whether or not they end up with an official ADHD diagnosis or not, it's good to be able to have those conversations with patients and give them support, whether or not you're doing a formal diagnosis. Speaking of formal diagnosis, DSM-5, which is the Diagnostic Statistical Manual, 5th edition, provides very clear diagnostic criteria for diagnosing adults with ADHD. Primary care doctors, including naturopathic doctors in states where we are licensed to be primary care doctors can diagnose ADHD. So this is something that I do in my practice. I don't just look at the DSM-5, talk to my patient for 5 minutes and say, yep, you got ADHD. We do a whole diagnostic intake. So there are a set of questionnaires that are screening for anxiety, depression, bipolar disorder, sleep disorders, as well as ADHD symptoms. And I use a structured interview called the DIVA 2.0, which is a funny name, but they all have funny names, to help me assess symptoms, their severity, how long they've been going on, and what the impact is on that patient's daily life. So I use a lot of structure in that to be able to get as much objective data as I can. It's challenging to diagnose mental health conditions in general because we see such an overlap between all of them. Depression, anxiety, ADHD, bipolar disorder, PTSD, all of these mental health diagnoses can have overlapping symptoms. So I think it's really important in my practice to go through talking about anxiety and depression and ADHD symptoms before I'm giving someone that formal diagnosis, because I need to know what's really going on. That, to me, that's treating the root cause. In naturopathic medicine, that's one of our main tenets, is figuring out what is the root cause, what's the problem, and how are we going to address that. So is it ADHD with anxiety or depression, or is it really just they're anxious and depressed because they're not sleeping well because their job kind of sucks, right? Maybe they don't have ADHD, they just can't focus because they don't like their work. So how do we help the patient get around that? Doesn't mean they need a stimulant, just means we need to figure out how are we addressing that root cause. Let's talk about some naturopathic approaches. So I'm going to talk about diet, some supplements, some botanical medicines, and some medications as well. So there are limited amount of studies on dietary intervention for treating ADHD in adults. We see that there are more studies on treating ADHD in kids with dietary interventions, but not as much on adults, which is a shame, but hopefully that will change. In this 2019 systematic review and meta-analysis looking at the risk of having ADHD, we find that diets high in refined sugar and saturated fats, aka standard American style diet or standard Western diet, are associated with a higher risk of ADHD, whereas diets high in fruit and vegetables are associated with a lower risk of ADHD. This is pretty common when you are looking at dietary pattern research. Dietary pattern research pretty much always shows that Western style diets high in refined carbohydrates, processed foods, saturated fats are going to be associated with negative health outcomes, whereas diets that are high in whole foods, fruits and vegetables especially, are associated with lower risk of pretty much every health condition. We also have seen in kids that synthetic food coloring additives are associated with increased symptoms. We don't know that that's the case in adults based on the literature, but if we know that diets high in processed foods are associated with a higher risk of ADHD, I think it's reasonable to say that avoiding synthetic food colorings is a reasonable intervention for adults. How much difference that's going to make, I can't say, but for some people that can make a big difference. Avoiding sugar, avoiding processed foods, they can really notice significant changes in their symptoms from that. And a lot of people will notice flares in their symptoms, or that having too much sugar, or having too much alcohol, or having too much processed food will really flare their symptoms. So even though there's not a ton of research out there to support these dietary interventions, this is something that gives us enough support to make these suggestions to patients and then allow them to kind of play around with their diet, listen to their body, figure out what is impacting their symptoms. Another dietary approach that has been used and shown to be moderately effective in children is omega-3 fatty acids from fish oil. Again, most of the trials are conducted in children, but modest effects have been shown in almost all the trials, which is pretty awesome because fish oil supplementation is relatively accessible. Good quality fish oil is important with this. And we also see that a higher EPA versus DHA amount is probably important for treating ADHD. We also have seen in a small randomized control trial with adults with ADHD and autism spectrum disorder that having omega-3 fatty acid supplementation did improve both working memory and attention. Again, there haven't been a ton of studies in adults, but I think incorporating fish oil as a supplement or fatty fish for most folks is a reasonable and safe option for seeing if this helps with their symptoms. We've also seen that omega-3 fatty acids and fish oil supplements are effective at treating depression. So if there's concomitant depression, this may be a really good option for that patient. When we talk about supplements, there's kind of a blurry line between dietary interventions, supplements, botanical medicines, but I chose the omega-3 fatty acids. That's diet, because you can eat fatty fish. Theanine is a supplement to me because even though it is found in black tea and more so in green tea, you'd have to drink probably 10 to 20 cups of green tea in a day to get this therapeutic dose, and I don't think anybody really wants to do that. So it's easier to just take it as a supplement. I love theanine as a supplement for folks with anxiety, sleep issues, stress, or focus and attention issues. I took theanine right before this talk because it calms me right down, helps me focus. So this is one of my absolute all-time favorites. We have seen that this has been shown to be effective as a supplement for kids with ADHD. So in these two studies, again, it's on children, but we see that it is effective compared to placebo, both for helping with sleep and also cognitive performance and inhibitory control, meaning that they're not having as much impulsivity or hyperactivity. So I think that this is a great option. We see that theanine has been shown to improve stress-related anxiety. So if someone is coming in and they are anxious and have ADHD, theanine might be a really good fit for them. And this is one that I use pretty much with everybody that I work with who has ADHD, whether that's an adult or an adolescent. Magnesium threonate is a specific form of magnesium that is able to cross the blood-brain barrier. So this is one that I use for neurologic or cognitive or mental health concerns. Not all forms of magnesium are able to cross the blood-brain barrier, so different forms are going to have different actions in the body, but this is the one that I use for mental health or neurologic issues. Open label pilot study, meaning that there wasn't a placebo group in this 2020 study. It was small, but it was on adults with ADHD. Found that nearly half of participants, so 47%, experienced clinically significant improvement in ADHD symptoms over 12 weeks. And they were using questionnaires for this. So about half of people showed improvements in symptoms. I think that magnesium threonate can be really, really supportive of neurocognitive function. I do use this a lot in folks who have TBIs or a history of TBI, maybe also have some ADHD or some focus and attention issues. Again, it might not work for everyone, but it's a reasonable option for some folks. Probiotics as a group, there are mixed results. I think it's really easy to lump probiotics into one big group and kind of just say, oh yes, probiotics do work or probiotics don't work. That's not really fair because there are so many different strains of bacteria that could be studied, should be studied, maybe have been studied, but maybe haven't been studied enough. So we don't have enough evidence to say that any single strain of probiotics is a home run for treating ADHD symptoms. Lactobacillus rhamnosus GG is a really commonly studied strain, and this 2020 trial in kids showed an improvement in health-related quality of life in those kids with ADHD compared to placebo. Again, this is kids and not adults. But from a naturopathic perspective, we are really frequently focusing on gut health because all health kind of leads or starts in the gut. Treating someone's gut, improving their gut function, because that's where you are absorbing nutrients, that's where you are, that's where you are getting the components that is making your body work. Treating someone's gut is never going to make things worse. Making their gut better will make pretty much everything better health-wise. And so I think it's reasonable to consider that if someone has ADHD symptoms, focusing on the gut is never a bad place to start or never a bad place to work on while you are doing some of these other more targeted approaches. Whether or not that means that you're adding probiotics or a specific probiotic strain, who knows? It depends on the person. But Lactobacillus GG may be an appropriate option. There are a couple of botanical medicines I wanted to highlight. One is saffron. So saffron, just like the cooking spice, has been shown to be as effective as methylphenidate, which is Ritalin, in short-term studies in kids with ADHD. Again, hasn't been studied in adults, but has been shown to be as effective as a stimulant medication in kids, which is awesome. It's also been shown to be an effective treatment for depression in adults, compared both with placebo, superior to placebo, and not inferior to conventional antidepressants. So awesome option if someone has both ADHD and depression symptoms. Quality is really important with herbal preparations. So you want to make sure you're getting what you actually think you're getting and that it's good quality. But saffron is a great option for folks with ADHD and depression. Rhodiola is an adaptogenic herb. We have seen in vitro studies, so in lab studies, that rhodiola can increase neurotransmitters, including dopamine and norepinephrine. Dopamine as a neurotransmitter is involved in the physiology of ADHD. I don't want to say pathophysiology because I believe that there, neurodivergent spectrum. Everybody is on a spectrum somewhere, so I'm not going to say this is a pathology. This is just a brain works differently. We've also seen that clinical trials of rhodiola in adolescents and adults have improved attention, cognitive function, and memory, but those aren't trials specifically focused on ADHD. So even though they may be improving some of the symptoms we think of with ADHD, they're not specifically in that patient population. I will say that I have used rhodiola with folks with ADHD, and some folks notice a pretty significant improvement, but not everyone does. Rhodiola can also be used for depression and anxiety, so I will use it again in folks that have comorbid anxiety or depression along with ADHD. I do want to touch on medication options because I prescribe medications. Naturopathic doctors can prescribe in many states. In the state of Vermont, as a primary care provider, I can prescribe both legend drugs, meaning kind of regular pharmaceuticals, and controlled substances like stimulants. So this is a part of my practice, and I think it's important for me to be able to offer my patients the full spectrum. Diet works for some people. Supplements and botanicals work for some people. They don't work for everyone, and sometimes you need a little bit stronger support. Medication can be life-changing for some folks with ADHD. Obviously, it comes with potential side effects, which are things that need to be addressed and understood by both the provider and the patient, but I think it can be a really effective and helpful tool in managing ADHD in adults. The research shows that cognitive behavioral therapy in combination with medications is better than either alone, especially better than medication alone. So getting your patients to work with an ADHD coach or a therapist can improve the actions of the medications. With medications, first-line treatment, according to standard conventional guidelines, is going to be stimulants like amphetamines or methylphenidate. There are both long and short acting options that can be used. Second line is going to be a more delayed onset of action. So you have to take it every day for a certain amount of time before you're going to notice actions. But there are many options that are not stimulant medication. So if you have a patient who has a substance use history or a family history of substance use, you may not want to use these stimulant medications. Again, I also mentioned that there are shortages of both amphetamines and methylphenidate right now. So sometimes you have to be a little creative and move back and forth between these stimulant medications and non-stimulants or off-label meds to get what you're looking for with your patient. There are non-stimulant medication options that are specific for ADHD, like atomoxetine or viloxazine. There are also off-label uses of medications, antidepressants like bupropion or venlafaxine, and medications for blood pressure. Guanfacine and clonidine both are used for blood pressure, can also be used for anxiety and ADHD. So there are many, many options for treating ADHD with medication if that is what is preferable and acceptable to your patient. We have seen that meta-analyses of treatments generally show greater effects from stimulants than non-stimulants, but in my experience, I have seen good results from non-stimulant medication options and kind of natural support in combination. So I think that there is a place for all of these options for folks. Remember, I don't know if you know, but you should know, stimulant medications are Schedule II controlled substances. So you do have to have a DEA license in order to be able to prescribe these because there is a high potential for abuse or diversion with these. So in order to prescribe this to a patient, we sign a medication contract together. We go over all the potential side effects, the potential beneficial effects, and we go through what this relationship is going to look like with me prescribing for them. I also do have to monitor patient prescriptions in a drug monitoring program that's set up by the state every time I prescribe this. And I have to monitor my patients regularly, check their heart rate, check their blood pressure, check in with anxiety, depression, other comorbid conditions to make sure that things are not worsening with these other other conditions, because stimulants do have side effects. All medications have side effects, and supplements have side effects. So checking in with your patients regularly is very important. Let's do a quick case. So this is a case of DB. She's a 42-year-old female. She came to me reporting issues with attention, executive function, and depression since adolescence. Had not been diagnosed with ADHD, but had been diagnosed with a recurrent major depressive disorder and also premenstrual dysphoric disorder, or PMDD. Current symptoms with attention and executive dysfunction always worsen around the time of her menses. We went through a full diagnostic workup together for ADHD. And instead of starting at the top with those first line medication options as a stimulant, we started at the bottom. So we started kind of in a naturopathic way. How do we incorporate nutrition and lifestyle into this? She started exercising more, especially around the time of her menses, and also was incorporating nutrients that were supporting estrogen metabolism and progesterone. So we did some seed cycling with her. She ate a lot of brassica or cruciferous vegetables because they have high levels of DIM and sulforaphanes to help process estrogens. So that's where we started. We started at the base of the naturopathic pyramid and kind of worked our way up. Over time, we ended up adding Vitex, which is chaste tree berry, and DIM as a supplement to help with progesterone support and estrogen metabolism, especially around her menses and as she's kind of going into perimenopause. We tried rhodiola. It didn't really work for her. She didn't notice a huge difference. So we ended up switching to a medication option. We did try methylphenidate and she didn't like it. She tried it for about 3 months in several different dosage strategies, and it didn't have the effects that she wanted compared to the side effects she was experiencing. So for her, methylphenidate was not a good fit. The best fit we have seen is venlafaxine. That is a serotonin norepinephrine reuptake inhibitor, an antidepressant medication that has helped with her depressive symptoms, but also has helped some with her attention issues. She's still doing Vitex and DIM and all of these diet and nutritional pieces as well. So I wanted to highlight this case because it shows you full spectrum of ADHD management from a naturopathic perspective. I don't shy away from medications if they're needed, but I also use the entire kind of therapeutic order and our pyramid of treatments to support patients, everything from diet all the way to medications. That's what I love about naturopathic medicine. We are trained to treat patients as individuals. So every patient I see is different. My approach has to be different with every patient. With that patient, she didn't want to start on medications immediately. We have worked together for 2.5 years. This has been a really slow progression, trying different things, seeing what's going to work best for her at that time. Every patient is different, so every approach needs to be a little bit different. I make my treatment recommendations based on the evidence, what is effective, what has been shown to be effective, what can the patient access. If she's not able to afford expensive supplements, then how do we get that through her diet? How do we get that through exercise or meditation or improving sleep? And also, what does the patient prefer? I look at my interaction and my relationship with patients as that it's a relationship. They get to make the decision in the end. I am providing them with information and education, but in the end, I'm informing them and they are getting to make the choice what is going to work for them or what they want to try. And that's what I love about naturopathic medicine, is that I have so many options to give people and such a broad range of treatments that we have so many ways to try to help their symptoms. It's not cookie cutter. It's not just one size fits all. And I think that's why patients really resonate with this medicine as well. So what I'm doing looking forward, I'm going to continue what I'm doing. I love being a PCP. I love seeing different things every day and managing lots of different conditions. It keeps my brain active. It keeps me really happy. I love what I do. I also do want to expand my telemedicine business and include some courses because I think that would be fun to be able to offer that to patients. My advice to you, if you're going into naturopathic medicine, be open to every possibility. It's not a one size fits all approach for patients or for you as a provider. It's limited by your imagination. You can really do anything you want to do. You have so many tools and so much knowledge and so much expertise that you can make your career what you want to make it. And I think that that's really beautiful. And I am always really inspired by talking to other NDs, as you know, my colleagues from school, and seeing what they're doing. People are really creative, and I think that that's a beautiful way to practice medicine. Okay, I'm done with my part because I want to answer questions.
Thank you so much, Dr. Korn. We do have some questions coming in. If you can just go to the next slide quickly, I'll announce some upcoming events. So next month, we have with us Dr. Jennifer Pierre. She's going to be discussing how to get a foothold on your practice. What are career plans that you should be making? So a little bit of what Dr. Korn just mentioned with that flexibility and understanding your plan and next steps. And then we have a panel of alumni who will be talking about their different pathways, and also providing some tips to you all as potential future students. With that, we can go to the next slide, and I will get started on some of these questions. So Dr. Korn, a question came in. You talked about fish oil and some medications and so on. Are there equivalents or things that vegans can do?
Yes, that is a great question. There are vegan omega-3 supplements that come from algae. They generally require a higher dosage amount because you're not getting quite as much per capsule or in a liquid dose. So they can be a little bit challenging as far as accessibility and cost, but there are options. Obviously, there are plant sources of omega-3 fatty acids, but the conversion in the body to EPA and DHA is pretty low. So it's easiest to get EPA and DHA preformed, and fish oil tends to be the best way to do that. But there are vegan options.
Thank you. Can you speak to, is there any difference? I know some people get confused between ADD and ADHD. Can you talk a little bit to that, please?
ADD is an old term for ADHD. So ADHD is the official terminology now, but there are different types. So there is predominantly inattentive type and predominantly hyperactive type. And I kind of think of those as ADD is the inattentive type. It's just the attention deficit, whereas ADHD, you have the attention issues, but also the hyperactivity. But the new terminology is ADHD, inattentive type, or hyperactive type, or both. You can have both.
Thank you. Can you put your contact information slide back up briefly, please?
Yes.
Yeah. Okay. So a couple other questions coming through. Let's see here. Do you have any insights on the medication shortage?
I think the medication shortage has a couple of factors that have been discussed. One is just kind of supply chain issues that have happened over the course of the past 3 years, but also an increase in mental health diagnoses, including ADHD. So there are more people using these medications now. It was just amphetamine class, but in the past 6 months, I've seen that in methylphenidate as well. Just Tuesday, I had to call a pharmacy to see what they had in stock because the patient last time had to go from extended release to immediate release twice a day. And so it has created some barriers and some additional work for all of us kind of working through that piece. Hopefully that'll be fixed someday.
Thank you. There have been all sorts of supply chain issues and, just lots of things showing how much of a global economy we truly are. Can you touch on some of the side effects from supplements you presented, please?
Yes, for sure. With fish oil, so we talked about that. So fish oil you want to be careful with in people who have bleeding disorders or who are taking blood thinners. There's also some evidence that higher doses of fish oil in older patients may predispose them to developing heart arrhythmias like atrial fibrillation. So I'd be careful about that. Rhodiola, I have seen be a little bit stimulating for people. So anxiety might be a side effect of that, which is kind of weird because you can use it to treat anxiety, but it's different for different people. As far as theanine, too much of it can make you tired and it may lower blood pressure. So people who are taking antihypertensives need to be careful with that.
Thank you so much. Can you talk a little bit about coordination as part of a healthcare team? So obviously, when you're talking about mental health, you may have patients who are seeing multiple types of providers, including allopathic physicians, psychologists, psychiatrists, counselors, and so on. You touched a little bit on that, but can you talk to how the ND works as part of a healthcare team, please?
Absolutely. Yes, I think that as a primary care ND, I often am managing everything for people, and I don't always like that. I am a naturopathic doctor. My expertise does not extend to really, severe mental health issues. And so I often will refer people to psychiatry or to other prescribers who are able to manage that piece. I also like to talk to my patients' therapists. So I ask my patients if I can get a release to talk to their therapist to get a better idea of what is going on mental health wise. I think that having communication between providers is so important. If providers refer someone to me, I always write a referral letter to them explaining what I did and why I did it. And I think that in that case, especially because oftentimes allopathic providers are not familiar with our interventions, I often will include references to studies, and I will, to let them know that I am done my due diligence. I am trying to keep the patient safe and do the most evidence-informed, effective treatments possible.
Thank you. So there are some questions about your telemedicine practice. And I know telemedicine varies based on jurisdiction that you're licensed in. Your Instagram does mention Oregon, New England. There's somebody from Connecticut who's wondering. So can you just talk about how telemedicine works and the types of patients that NDs can see and how that scope of practice works?
Yes. So I think with that practice, I am only practicing telemedicine in states where I am licensed. And I think that is a key piece for me because I don't want to step outside the licensure bubble or protection with that license. So I have licenses in each of those states. Scope of practice is different in every state. In the state of Vermont and in Oregon, I have a really wide prescribing formulary, so I can prescribe lots of medications. In Massachusetts, I can't prescribe at all. So I have to know state by state, where is my patient? What can I actually do for them? Which can be challenging to remember that and to keep that in mind. So I have really try to be really organized with my office staff about where my patients are, what we can do, and I keep notes on where they are. Different states, having a different scope of practice also includes what labs you can order. For instance, in Maine, where I have a lot of my patients are in Maine in that telemedicine practice, I can't order provocative testing. So I can't order SIBO testing, which is something that I actually do a lot in my practice in Vermont. So even though I can order most lab tests, I can't order certain lab tests. So there are individual differences state to state that I just have to be very aware of and keep in mind.
Thank you so much. All right, I'm trying to fish. There are a lot of questions coming through here. Can you talk about any apps or tools or resources that may be helpful for folks?
Just generally or specific to?
For ADHD, any apps that you tend to like for patients?
Yes, I think that for some folks, mindfulness can be really helpful. It's not helpful for everyone, but things like Headspace or Calm can be helpful. There are also really great resources on CHAD, which is the kind of national ADHD organization. They have a lot of great resources on their website. And I think that finding ADHD coaches for many of my patients has been kind of the most impactful resource for them. Just having someone who is not necessarily a therapist. You're not talking to them about your struggles or trying to get mental health advice from them, but it's more like almost occupational therapy, right? How do I go through my day? How do I structure my time? How do I manage time? I've had a couple patients be really successful with the Pomodoro technique, which is like you use a timer that I think was originally shaped like a tomato, but you can use any timer to kind of structure your day and help with that time management, executive function piece. It's different for different patients.
Yeah. Do you have guidance on tips for finding a good ADHD coach?
I would make sure that I would look on a CHAD or on the CHAD website or the Attitude magazine, ADDITUDE magazine. They have resources on their website as well for finding professionals that can help. So I would go through one of those organizations.
Thank you. There are a couple questions on fish oil. If you could speak to EPA to DHA ratios and kind of ballpark, what types of general areas you're trying to get for dosage, and as well as, how long. I think a big question people have, a lot of times you'll take a conventional medication and many of them are quickly acting. So how long do you expect for things to start to take action?
Yes, good questions. So fish oil, I think that number one thing about fish oil is quality is really, really important, because you want to make sure that this is not rancid fish oil. You want to make sure that it doesn't have heavy metal contamination in it. So getting it from a reliable, well respected source, I think is really important. As far as EPA, DHA ratios, when you look at a label on fish oil, it will say EPA, DHA, and then other omega-3 fatty acids. So it may be 1,000 milligrams total dose, but EPA and DHA is what I look at. I don't look at those other omega-3 fatty acids. Generally, you're going to have a higher EPA than DHA in most fish oils. So in general, that's what we want with ADHD. I start with 1,000 milligrams combined EPA and DHA a day, and then work my way up, sometimes 3,000 milligrams a day. It really depends on the patient and what they're experiencing. As far as the duration and how long it takes to see it work, I think that also depends on the patient, but ideally within 4 weeks, you're noticing some difference. I will say that fish oil, I have not, with ADHD specifically, I've not seen it be like night and day difference. They start fish oil and suddenly they are just like super productive, focused, chill people. It's a supportive recommendation. It's not something that's going to, change their whole world. But not everything has to be something that's going to be like the magic bullet. Supportive treatment is completely reasonable and helpful for people.
Thank you so much. Can you speak a bit to environmental factors? I know you talked about dietary factors, but when we're thinking about brain inflammation, there may be environmental factors on board. And so how do you uncover that? How do you understand that better?
That is a big question.
$1 million question right there.
Yes. Right? There are definitely environmental factors at play with pretty much, truthfully, with pretty much every condition. I think we are seeing autoimmunity, mental health issues, autism, all these kinds of things. We know that the chemicals that we are exposed to in the environment have a relationship with that. We don't know what the causative relationship is. And we also don't always know how to get them out of the body. So the biggest thing is just avoidance for most people. So avoiding, plastics, parabens, phthalates, turning off your Wi-Fi at night, putting your phone on airplane mode, reducing EMFs, figuring out if any of those things are flaring symptoms. We don't always know like definitively, or there's not a test that can tell us that. Sometimes it's just talking with your patient and getting them to try it for 2 weeks, see if you notice an improvement in symptoms. I will also say that I think environmental factors should also include society and expectations in society, and that someone with ADHD, the depressive issues and anxiety issues are oftentimes because our society and our world wants people to be very productive and be able to, function in a certain way. And if that's not how your brain works, it can really affect you. And so figuring out, again, this is where an ADHD coach or a therapist comes in. How are they managing their day-to-day life in a way that's supportive of their own neuro pathways and how their brain works.
Thank you so much. Can you speak to, so there are a couple questions about CBD / medical cannabis.
Yes, I do not use CBD or medical cannabis specifically for ADHD in my practice. So I will say that patients often will use CBD specifically for kind of anxiety issues. I think that the research right now, the limited research that is available, is showing that CBDA may be more helpful for anxiety than CBD, um, but I'm not an expert on that.
Thank you. Can you speak to exercise and movement and the timing of exercise?
I'm not sure I can speak to the timing of exercise necessarily, but absolutely exercise is helpful for eh, pretty much every mental health condition, depression, anxiety, and ADHD. One of the issues I think with ADHD in general is the dopamine pathway in the brain, and exercise can help kind of promote dopamine in the body. So it is a healthy way to get more dopamine rather than looking for other ways to do it. When we're thinking about depression and anxiety, the research shows that depression is as effective or more effective than conventional antidepressants. So yes to exercise for everybody.
Uh, so I think we are we're wrapping up on some of the questions here. I've got time for maybe one more, and I'm typing some answers as well. So do you have, I know you talked about quality of supplementation. There are also different forms that supplements come in: liquid, capsules, teas, etc. I know in regard to rhodiola, there was a question about which form is better, and you spoke to the different forms of magnesium and so on. How do naturopathic doctors know what form to prescribe?
That is a lot of education in the naturopathic curriculum, but also it's a lot of clinical experience, and those are things that I have learned from working with other doctors. One of the key pieces of naturopathic education is doing observation hours in the community with other doctors, as well as doing your clinical rounds, and learning those kind of clinical pearls from people who are practicing is invaluable. We do, I remember covering that in the curriculum, but I think that in practice, you learn a lot from other folks who are working on the ground. Oh, I think
There was a
you're.
question, yeah, there was a question about the earliest ages for diagnosis in children of ADHD. I know that the American Academy of Pediatrics has guidance there. Every once in a while we'll hear like my teacher, my kindergarten teacher said that my child had, or the preschool said my child has ADD. And so I would just guide those of you who have questions about the diagnosis of children. The Academy of Pediatrics has all of those guidelines as far as what age and what diagnostic tests need to be run for a formal diagnosis in a child. It isn't something that your teacher can just offhandedly say, Joey needs, or Jojo needs, whatever. There's a formal process for diagnosis there. So, Dr. Korn, we're going to wrap up today, but thank you so very much. I really appreciate you taking the time. This was a really meaty conversation. There was a lot of information here. For those of you who have inquired, we will be sending out the presentation recording when it is completed. And so keep an eye out for your inbox there. We also do post all of our archived recordings on our website. So thank you again, Dr. Korn. This
Thank
was
you so much.
fabulous. Thank you for coming. And for those of you who joined us today, really appreciate you taking some time, and we'll look forward to seeing you at another event in the future. Take care.